Respected doctors, my dear doctors, my lovable doctors. Today I'm going to help you with lot many questions regarding medical portion, regarding professional questions, regarding your personals. I'm going to help you. I'm very happy today since it's my responsibility as a teacher also on this Teachers Day. I should do something special which my students can't even think. Yes यार ये भी हो सकता है, सर इस तरीके से भी हेल्प कर सकते हैं. So those of you who want help, अगर उन्हें लगता है कि yes they need help, उन्हें कोई क्वेश्चन लगता है ऐसा which they are able to answer, which they feel as if uncomfortable. Many students are writing me, sir, please tell me my strengths. So well, at times I say them, yeah, actually I'm not well aware about your lifestyle and anything, so it is not possible for me to tell exact things and about you. Now that through this live it is possible because I'm giving you one number here. On this number you can call us and you can ask your question. We will definitely help you out. And in this live, if my doctors are shy enough and they are not asking questions, if they think, oh sir, we have to call to you for this interview preparation, then it would be justified for you and benefit for you. It totally depends upon you. And if you don't call, then also I'm going to help you with lot many topics. Like first regardful thing which I want to tell you, that all these can be possible only because of my lovable students, those who are doctors, those who have gone for interview. It is only because of them. Like I have given you and I'm going to give you lot many questions. In morning also I came live on my Telegram ID and on that channel which I have specially designed for doctors. On that particular Telegram channel I have come live for almost 10 minutes and I have given abundant of questions, medical questions to my students. And all these can be possible because when our students are going, you might have seen when they are going, they go for interview and before their interview, like result, they send us the questions. They send us, yes sir, these are the questions, so please send it and help the students. So same case I want from all of you also, that whenever you are going for anywhere for type of interview, AMC and all this, so if you really want to help others, then help in justified manner. Today what topics I am going to give you is very interesting, and since one good thing which I found, एक अच्छी news है which I want to give it to you also, that till today it is 5th of September, my student, those who have done the courses till yet, whose interviews have been conducted, they all have got selected. सबसे अच्छी news, this is the best news for me and my students. It's a good thing I can say, that those who have gone for interview till today, not a single student has remained. एक कॉल आ रही है, मैं कॉल को ज़्यादा फर्स्ट प्रेफरेंस देता हूँ, तो आई वॉन्ट टू गिव प्रेफरेंस टू कॉल. हेलो 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 डियर. Hello, yes, dear. What's your good name?
Good evening, sir. I am Dr. Satish.
Yes, Dr. Satish. How can I help you? Please ask your question.
Yes, sir. I had my root canal procedure done 6 months back.
Pardon, doctor. Ask your question again, please. I didn't get. I will definitely reply your question. Promise.
Yes, regarding that medical fitness, I am asking that question, sir.
Ask your question, please, regarding medical fitness.
So I had my root canal procedure for tooth dental.
Oh, root canal procedure. Okay. Root canal procedure. Okay. I don't think it's a major problem, but still, if you want, then you do one thing, Dr. Satish. You WhatsApp me this problem in such a manner that if anybody can read, he understand what do you want to ask. I promise you, when you write there, I am Satish sir, talked to you on phone. I promise you, I will send to one of my doctor and get a best answer for you. Is it okay, doctor?
Okay, sir.
You have to WhatsApp me on my WhatsApp number. You know my WhatsApp number? 9414210410.
Yes, sir.
Yes, there you have to WhatsApp, not here. You have to WhatsApp on that number. That is my institute number. Okay?
Okay, sir.
Okay, Satish. I will solve your problem. What is your interview date?
24 September, sir.
Oh, you have good time. Yeah, don't worry. You will become successful. I promise.
So another question may I ask, to ask, sir.
Where you are from, Dr. Satish?
I am from Tamil Nadu, sir. I have completed my orthopedics in postgraduate.
Oh, orthopedics. That's great.
Yes, sir.
Great. Okay, best of luck for your interview, doctor.
Oh, thank you, sir. Thank you.
Okay, dear. Best of luck.
Thank you.
Any more doctor want to ask any question, they are welcome. And today I am devoting this thing only to my doctors. And those doctors who come later on in this live, I will definitely help them also, because I have brought lot many questions for you. Practice these questions. Just now one of my favorite student, Bhageshri, has told me a very good question, which I most of the time tell my students. That is, I remember the name also, ICD, that is, wait, let me give it to you. Triangle of safety, you might have heard also. Since you are a doctor, you know better. Yes sir, we know very well. This is your topic which you are talking about. So triangle of safety topic has been asked, and few important topics which I want to give you personally. If you prepare these topics, like dengue is a very important topic. Most of the topics you must go through, students, as much you can. And now that again I am saying, if any doctor want to ask any question regarding their life, regarding professional, regarding personal, I am ready to help. Once this live get finished, please, it is very hard for me to talk, to give time. Please, right now I welcome. And if any doctor watch this live after the completion of this live, then they cannot call, they can write their message over here, and if possible we will reply. But right now, if any of your friend, any of your person, if you are a doctor and watching this live, please share this live to any place, any telegram group or any WhatsApp group where doctors are there. If they might come, they might get benefited. So if you want to benefit the society, want to help others, definitely good will happen with you. You might have seen today also my two students got selected, and before their result they have written also, sir, result awaited. Before their result they have sent the questions to me. Such dedication if you have to help others, to live for others, definitely God will do best for you people. Need not to worry for your future. Your future is in great future you have, don't worry. So if we live such a life, that is more beneficial. So today my topic, I am giving you seatbelt injury, blast injury, ectopic pregnancy. Ectopic pregnancy has been asked I think almost 3 times. And live vaccine is a very important topic for, I don't know why these topics, like I thought pneumothorax would be important, but you know student, after 2 days, till 2 days past of interview, I didn't get that pneumothorax was asked. But today one of the guy has conveyed me, sir, pneumothorax was asked. So some topics which I feel like ectopic pregnancy is a choice of mine. Yes, they asked definitely. And this time our student was asked this question. One guy is writing here, one doctor is writing, Dr. Deepak, sir, I am 4 kg above normal weight. Will it be given time? 100% Dr. Deepak, they will give you time first of all. Another point is that you need not to worry at all, because they will give you 42 days more to reduce. And I promise you that you can reduce your 4 kg weight in one day if you made yourself think as if, yes, I can, then everything can be possible. But since I think definitely there must be a week in your interview, so you do one thing, right now onwards, you start skipping your dinner, have some running, and definitely when you reach these 4 kgs, I don't think it is a big problem will create. No, not a single problem will get created. I promise you. And student, more topic like fly chest is a very important topic. If you go through this topic, it is, oh Deepak, thank you so much. Deepak, I suggest you, if you are saying thank you to me, don't tell thanks. Instead of that, you send this live to any of the doctors group, any place where other of your friends can take help, if possible. If you think, sir, yes sir, I have one group, I have seen one on Telegram, WhatsApp, if you say, if you can, you send it right now. Because once I go from here, definitely it's not possible for me to help everybody, but right now I can help. And I'm compromising my gymnasium time over here, because my friends are waiting and they are saying, why you have taken this headache here today? After 7 you told that whole day you are busy. Agree, right now this is your exercise time, so let us do exercise. So I told them that give me some time. It's a teacher's day, so I want to help my doctors if possible, as much I can. It's not that I would help them 100%. I know very well you cannot make everybody happy, student. This is right. Nowadays I have seen this thing. Okay, next is first day. One of my student was asked national health program. So I suggest all of you that you must go through National Vector-Borne Disease Control Program, and to control tuberculosis there is a program RNTCP. So, and that national vector, that NVBDCP. If you are well aware about these programs, then okay. But you must you must know what are these programs. If you know, then okay. My student was asked this question: tell about the national health programs. So he named 2 3 I think, and they told okay, let it be. Next topic I am giving you: flail chest, stove chest, whiplash injury, raccoon sign, battle sign, lucid interval, crushing reflex. MI is a very important topic. I have seen management of MI yesterday asked from Abhijit, one of my students. He has got selected also from Deoria, Uttar Pradesh. Today our student was from Maharashtra. They have got selected. And one student Mr. Deepak, he has come to me only for 3 days. He told me on 25th I think night, he told me, sir, sorry, I came to know about you, and one of my cousin told me she has got selected actually 2 years back. So I have only 3 days. Would it be possible? I told, yeah, why not? We will teach, not give you one class, we'll give you 2 classes, like morning evening, we'll shift and we'll make you successful. He told, sure sir. I told, my promise, you go through the course. And within 3 days he prepared himself. He's from Tamil Nadu and he got selected student on 28th. You can see his pick. 100% he has got selected. Only 3 days preparation. So he was asked this question. So I remember this thing. And regarding MI, I have said, see students, I'm giving you 2 3 topics here. One is MI, another is trauma, and another, like they ask you about angina or cardiac arrest, or based on cardiac things. Sometimes they ask. But the more important topic, I don't know why they ask question based on myocardial infarction, with types of myocardial infarction, how will you manage and all this, and ECG changes in MI. So although they don't ask very easily that what is MI, they will not ask you. But question would be from there. But yesterday question was quite easy, management of MI. I think my student must have given, that's why he has got selected. And here there is a question like ACLS, BLS, these are the questions. And I suggest my students that, student, I agree with you, there are lot many doctors who would go through these classes later on, who would see these topics, who would write down the topics. I agree with you. But if you have any question, just now Deepak has asked this question in written, and here our Satish has called. So if you have any question, there should be no shyness. You should have guts to call and ask the question. But once this live is finished, then you cannot call a student. So I suggest you that you should give a call, and it would benefit you only, because I can handle all your questions. If you ask me today any personal also, I would help you. But see students, if you would not call, then only also I will help you, but I will help you in such a manner that I will give you personal professional questions unable, but I can give you medical portion, this I can support you. But when you call, then I think your confidence would get boosted up, and definitely I can boost your particular enthusiasm towards this interview, make you passionate enough. Coming on the topics like HAPE, HAPE, prepare this topic, it is a good topic. And next is snake bite, intubation, hypovolemic shock, water purification topics are important. Typhoid is a very good topic, frostbite, malaria. I think mosquito related topics you must go ahead. Okay. Next is coming with the active and passive immunity. I think you must go this topic. And bilirubin value, alcoholic liver disease, ORS. Causes of jaundice is a good topic. Causes of acute pancreatitis you must prepare. And fevers, like there are different types of fevers, so remittent fever and all this can be asked. Acute pancreatitis I have already conveyed you. And in bites, one of my student was asked scorpion bite, although I always suggest my student that prepare snake bite, prepare dog bite management, very important. So today also I suggest you that rabies is a very good topic, prepare it well, you must know the doses and everything. But when yesterday this thing happened, like she was asked scorpion bite, so I think definitely in interview mind again that question can raised. So you must prepare, and if you don't know, then you can. If you know very well, then it's okay. And you are a doctor, we expect you know much better. And one thing is, I know very well, doctors, that your knowledge, like regarding MPPS and all this, you have studied this for 5 years, right? So your knowledge is much. more, I can say. It is the true fact. Like suppose if I talk with you anything, like I tell you like classification or whatever topic comes in my mind, you know better than us. This is sure. But student, what happens? Many things we know very well, but we are unable to deliver. I have talked till today more than 500 doctors. And all these doctors, when I talked them, I found only one thing. Many of them said, Sir, knowledge to hai. We have knowledge. But only problem is delivery. Sir, we are unable to deliver the things. ये problem है. तो क्या ये problem solve होती है? Yes, it can be solved. How? See students, it can be solved by practicing. And you must have a right mentor. You cannot be a football of everybody's leg. If you say, sir, my father is a doctor, my father is an engineer, my father is an instructor, my father is a businessman, and I am giving interview to my father, then it is not bad, it is good. You are giving interview to your father, it's good. But I suggest you can give interview to your father, but don't ask his suggestions. Because he is not a specialist. He is not well aware that what are the signs, what are the particular things we are doing. So when I taught one doctor and she told me, sir, I have given this interview many times. And when you told me about the body language and you told me the very first day what I'm doing mistakes and all these loopholes. So I thought that really these loopholes matters. And when I talked with my family members, are these loopholes in me? They told, yes, these are your loopholes. Then why didn't you told me? Because they were not well aware that these are the loopholes. When she told, yes, they agreed. So the thing is that without a specialist, like if I have to practice football, I cannot go elsewhere other than a football coach. A chess player cannot teach me a football. A football coach will only teach me football. So interview presence or practicing or mock interview can be done. You can practice with your mother, you can practice with your father, sister, brother, you can practice. But don't take their advice at all. Because what happens, some points which you are good enough and you think and they think, yeah, these are the loopholes. Unnecessarily you are removing those points from your life. But actually these are your real points. Like without these points, your personality doesn't matter at all. So we leave those points. And we don't know what are the real points we have to keep, we have to remove. That is a major problem. So that should not come. Better take help from a right mentor. That is more better. And one more thing I want to suggest. Many of the doctors are calling me, they are asking me, sir, can we give this interview in Hindi because I am not comfortable with English. मेरा इंग्लिश अच्छा नहीं है तो मैं क्या इस इंटरव्यू को हिंदी में दे सकता हूँ. तो I suggest them, see, my suggestion is accurate, please listen, it would help you only. See, you can give your interview in Hindi but not the initial part. Now you will ask me, sir, what is this initial part? The initial part of interview is like when you are going and you sit in front of them, definitely they will ask you some HR based questions. Directly they will not ask you, yes gentlemen, tell about gunshot. They can, but probability is less. I have seen 20% of the students were asked directly medical. 80% of the students, you must be also knowing few personal, like what you are doing, what is your experience, okay, anesthesia, okay, then tell about anesthesia questions and all this. Just now what I experienced from my student. So all these things will happen to you. At that moment, means at the initial part, if you speak Hindi, then it is not justified. So please remember that you can speak Hindi in medical portion, that is also up to the limit. Because now you'll ask, sir, why can't we speak Hindi here also? Because we have stopped us to speak Hindi in HR questions. Okay, we'll speak English. But HR we leave. Now come on the medical portion, you are saying up to the limit you can speak Hindi. Why? Now I'll tell you. See students, all the interviewers might not be knowing Hindi, then what you will do? They might not be knowing Hindi well, then what you will do? They might not be understanding Hindi well. They know Hindi but not well understanding, then what you will do? At that moment, English only can help you. So I suggest you, if you have time, if you think, sir, I have 3-4 days, I have 5 days, if you think you have time, then you can avail somewhere benefit. If you think PD classes is good, you can join PD classes. If you think other classes, you go anywhere. But the thing is, if you join, you come to know about your loopholes. You speak little bit English. Every teacher, I'm not saying that only I will teach you, but in life, wherever you go, every teacher is good. Wherever you join, the teacher will train you. The teacher will make you comfortable in your language also, as we are doing. What I am doing, I am making my students to prepare in English only, everything, all HR and all questions. Now what happens, they practice in English. The same questions they ask most of the time in HR. And till today, as I told you, till today means 28th of August to 5th of September, my all students have got selected in interview. This is a challenge I can give. If you find any student who has joined PD classes and in these days between 28th to 5th, anybody not selected, you can show me, I will give you a prize. So I promise you that this is a true fact. How can it be possible? With language, personality. One psychologist sitting there who would be watching you, who would be seeing you all your activities. So please don't unnecessarily scratch your body, move your body, shake your body. Not many errors people are doing, I have seen while taking interviews of doctors. So please avoid those things. If you avoid, definitely it will benefit you. Coming on the medical portion more, ascites is a good topic. Today I asked one doctor shifting dullness question. So if you are having and you say, yes sir, I can easily manage this question. You are a doctor, yeah, you are an MPPS. And I always say my doctors, yeah, your knowledge is more than me. I know the periphery, but you must be knowing the depth of it. Okay, so it is good. And I also feel comfortable when I talk to you, because you people are very intelligent, and when we are talking with intelligent people and asking questions, when you come on the topic, then I feel as if yes, you are going quite in depth. So I become happy. Like today, one of my student told me, sir, in shifting dullness, this also happens. I told, okay, yeah, that's good. Really, your knowledge level is good. Okay, then coming on alcoholic liver diseases. I think you should go with these topics also. Then diabetic question is quite like diabetic mellitus, diabetic gestational diabetes, and all these topics are quite important for all of you. ECG already told you. Treatment of STEMI is a good topic. You can prepare as per your convenience. And if you need all the topics, definitely students, we are ready to help you out. And then comes your SGLT2 drugs. If you know about it, it's good. If you are not well aware, you can search up. Water purification strategy is a good topic. You can. And then comes your day before yesterday, I think, one of my student was asked this question: what is the difference between epidemic, endemic, pandemic? If you prepare this question, you would definitely remind me, yes sir, आपने कहा था, मैंने कर लिया था, तो today it is helping me. That's good. And although student, there is a ocean of questions I can say, but what I want to say that is, see, when you are going for interview, it's not that interviewer nowadays what they are doing, they are taking interview in random manner, like anything they can ask. Till yet, whatever a students conveyed me, whatever they have told me, I have seen one thing: they are taking interview in random manner. So whatever, like suppose they are sitting and yes, gentlemen, come. Okay, so what type of particular like tell the malarial disease. Okay sir, this malaria, dengue and malaria. Okay, and malaria. Okay, then you tell me that the doses of chloroquine. Okay, you tell me the quinine side effects. Like they ask anything. It's not that they would see, okay, then malaria. Okay, I'll ask about only malaria. No, they can ask about Kala-Azar, anything. Like they can go any mark. So you should not be stick to one point. Yesterday one doctor has written one line: sir, please convey to all your students and others that I have given interview, and he has written, sir, tell every doctor, don't stick to one point and go in depth. Need not, sir. They must know. If they are knowing prescription management and all these diagnosis and causes and everything, then okay, enough. Need not to go in depth and read again and again. Need not to worry. Okay, student, then it is my duty to convey you people also. If you do this thing, it will benefit to you. And then C-spine injury is a good topic. Gonorrhea treatment is a good topic. ENT manifestation of HIV/AIDS is a good topic. and cat and dog bite management. You can go through this topic. Many of the doctors would be watching our videos later on, so I suggest them that right now what number we are giving, they need not to call on this number after the live, please. They can only WhatsApp us. You have only one option to contact us, that is our WhatsApp number 9414210410. And most of the time they are asking questions like clopidogrel dose, chest pain management, secondary attack rate, and precautions during intubating COVID patient. Not now COVID patient is important, but the question is that precautions during intubating COVID patient. So you must know the question. Then comes other medical portions like integrated vector management. This is a good question, I can say. Surgical instrument sterilization is a good topic, and then ethambutol and hypertension diagnosis is a good topic. Corticosteroids complications and lower limb ulcer, donning and doffing, good topics. Ports fracture, Colles fracture is a good topic. You can prepare. ICD, yes, this topic I was searching initially with the very first part I told you. This question was asked today from one of my students. She's from Pune, and she told me, sir, triangle of safety. She told me, sir, ICD was asked. Then I told, I said triangle. She told triangle of safety was asked, and I told ICD. She told, yes, sir, yes. And I told, okay, that's a good question, and was asked prior also. And pediatric vaccine schedule, if you prepare this topic, it would helpful to you. And student, the one thing very important, that is your body language. Then comes your communication skills, your own personality. If you work on these topics, ultimate results are coming. Ultimate. They only see one thing, is your confidence. If you are having good confidence in speaking, that's good. I have taught many students, and one doctor told me, sir, last year I have given the same interview, but what happened, they asked me the questions, I started fumbling unnecessarily. I don't know, sir, why. I know the answer, and I know I have treated, because I have been working that time also for 1 year. So I told, what happened? She told, sir, I know the treatment very well, but I am unable to explain them the treatment, and I fumbled. Then I told, oh, then she was rejected unnecessarily. So she told, this time, sir, I want only communication skills to be developed. I know medical part, this is good. So I have seen most of my doctors are very intelligent. Whenever I name them prevalence incident versus incident, they say, oh, sir, need not to. Hookworm infection, अरे sir, कर लेंगे. And when I talk to them other topics, बायोलॉजिकल वेस्ट वाले, सर बायोलॉजिकल वेस्ट मैनेजमेंट बहुत ईजी होता है, सर BMW मैनेजमेंट संभाल लेंगे सर. सो दे नो द थिंग्स, बट ओनली रिगार्डिंग कम्युनिकेशन स्किल्स इफ यू प्रैक्टिस. एंड मोर इम्पॉर्टेंट आर योर HR क्वेश्चंस, बिकॉज व्हेन यू टॉक टू देम इनिशियल पार्ट, they ask you common questions, what are your strengths, hobbies, but if you speak with proper decency, proper body language, if you enter, if you come, you sit properly, you show your decency, the way. And believe me students, I have taught abundant of doctors, but have to teach every doctor regarding body language, believe me. And every doctor is appreciating, yes sir, ये पता नहीं था कि ये भी बॉडी लैंग्वेज भी इंपॉर्टेंट होता है कि इतना और ऐसे करना होता है, मतलब ऐसा नहीं पता था. तो दे फील वेरी हैप्पी. So if I suggest my doctors that you should go with proper body language, your HR question should be good, and your medical portion should be good, and then you practice mock with the right mentor, it would definitely helpful to you. Now students, if you have any questions, need not to call, because whatever I have given you, definitely these medical portions would be helpful to you. And we have only one option, that is WhatsApp. Here I am giving you WhatsApp, so that you can contact us on WhatsApp number. Any question remained students, you can talk to us, no problem at all. We are ready to help you. And yes, you know students, our WhatsApp number 9414210410. Okay, so after this live you have only one option to WhatsApp us, need not to call on this number, nobody will pick your call. This number is only when I come live and anybody doctor help. So today one doctor has taken help, Mr. Satish, we appreciate him, and I have given a lot many medical questions to you, might be beneficial to you. If you have any question remained, or you'll be watching after this live, you can definitely contact us, we'll help you. Okay, thank you doctors so much for watching and enjoying this video. I hope a lot many things you have